Case study 8. Hypothesis. The gastroesophageal reflux disease, GERD, can be helped or managed via visceral manipulation. The reason this hypothesis was chosen is because the therapist is interested in the effect of visceral manipulation on a regular patient with a digestive tract problem, which hasn't been addressed in the past. And he also happens to be a good friend of the therapist. Health history. A 42-year-old male patient presents with the pain when swallowing, eating, and having trouble with a deep sleep and antalgic arm referral. He also struggles with various other digestive tract issues. The patient has had a history of hepatitis A when he was 14-year-old, when he has been dealing with back then. He also developed a chronic GERD as a result of stress factors in his life. The client has an unstable work and doesn't guarantee the stable income, which contributes to the difficulty of his psychosocial circumstance. In the past, he has been struggling with the mild depression. Outside of his work, the client does not attend a regular exercise routine and therefore is more prone to repetitive strain injuries and imbalances. The client's basic screening test reveals the following. Mitchell's screening test shows difficulty of global extension, the opening up of the chest area. Structural test shows a significant flat back and hyperextended knees. The sacrum is counter-rotated, but sacrum is symmetrical. Having a fascia assessment using a global listen test, one hand on the head, other on the back. His body corrects when touching the L spine slightly. However, the pull is much stronger towards the front, pointing to the visceral organs at the top part of the abdominal cavity. The local test confirms concretely that the stomach-esophagus area is being the primary issue. Secondary problem detected through the exclusion method is the liver and gallbladder. Then the ascending colon is tertiary, and the prostate is the last one detected. The motility is restricted during extension. Motility of stomach and esophagus is reduced in inspiration and expiration, and consequently the mobility is affected as well. Biological determinants. Based on a therapist's observations, we can see that our client has multiple lesions which are predominantly psychosocial and hereditary in nature. We have an example of psychovisceral lesion where the client was going through some major stressors in his life and was starting to develop a chronic GERD. Signs and symptoms of GERD include burning sensation in your chest, heartburn, usually after eating, which might be worse at night, chest pain, difficulty swallowing, regurgitation of food or sour liquid, sensation of a lump in the throat, constant clearing of throat. The causing factors is the recurring backup of the acid reflux from the stomach up to the esophagus. If the sphincter reflex is abnormal or weakens, stomach acid can flow back up into your esophagus. This constant backwash of acid irritates the lining of esophagus, often causing it to be inflamed. If one has a nighttime acid reflux, one might also experience a disrupted sleep. The main factors that provoke it is bulging of the top of the stomach up into the diaphragm, the hiatal hernia, which has been our client's past concern as well. The aggravating factors which keep this problem going is eating certain food triggers such as fatty or fried food, drinking certain beverages such as alcohol, coffee, and smoking. The above factors apply to our client as well as his lifestyle habits are very poor. What may improve our client's overall health is attendance to the health clinic, regular visitation to the medical doctor who would benefit he would benefit greatly from being referred to a gastroenterologist. It is the duty of the therapist to refer a client to other specialists, as the patient may not be aware of the problems which may arise if he doesn't follow up with the medical doctor. Moreover, the therapist would recommend the modalities such as physiotherapy clinic to improve the lower cross syndrome imbalances of the hip, the osteopath for sacrum and low back alignment and visceral manipulation, and dietologists for learning how to balance the daily food and their proper cooking. Then for the stress level to go down, the religious practice or psychologists would be essential in regulating stress and other psychological issues such as depression. Time frame of the study. The study is based on two 90-minute treatments, each treatment consisting of 10-minute assessment, 70-minute actual treatment, and the last 10-minute reassessment and home care instructions. Informed consent has been agreed upon, satisfying the partnership principle. Tools used. Hands only are used for palpation skills to give out the fascial pool, the global and local listening, the motility, the mobility, the motricity, as well as the 4 T's are used as assessment tools. Special tests such as Mitchell screen test, the straight leg raise test, that is for visceral cause of musculoskeletal complaint, the structural assessment test, and the bowstring theory were utilized. Patients' objective and subjective feelings, such as the state of being on scale from 1 to 10, is used to measure the neurological and emotional improvement. Reassessment of the posture was used to see the structural improvement. The indirect fascial technique, such as the seesaw technique, has been used as well. Chapman reflex, the neurovascular and arterial supply points chart was utilized to treat the referral and supply points. The health history form has been taken to monitor and record the data for our patient. Results. Our client has had an improved sense of well-being, rating himself as 7 out of 10 in terms of feeling well emotionally and health-wise. In the stomach area, and almost no acid reflex moments for the period of 1 week. The client's basic screen test revealed the following improvement. Mitchell screening test shows ease in global flexion and extension. Structural tests show the flat back is getting more curved with proper postural exercises, and the sacrum is more nutated. The hyperextending knees are still there and need to be addressed with more treatments and lifestyle changes. Moving to the fascia assessment. Using the fascia global listen test, one hand on the head, other on the back, his body shows minimal correction, if none at all, at stomach esophagus level. The local test shows great motility in inspiration and expiration of the esophagus and stomach, good organ mobility, 4 out of 5, and the Chapman points aren't being tender. However, the tertiary conditions such as the liver, gallbladder, ascending colon, and prostate still need to be worked on in our future treatments. So now the liver became a primary concern, and having replaced the stomach and esophagus. Personal treatment plan. Client has approved the treatment plan as proposed by the therapist. The convenience of location and freedom of our patient's schedule allowed us to be able to meet for 2 treatments within a 3-week period. As for our immediate goals, the client has agreed to stay more attuned to his health issues, to stop drinking alcohol and have a better diet. He was also following home care recommendations for his back and hip issues. The client was recommended to attend the medical doctor for his prostate problems as well for other digestive issues. Now about the treatment itself. During the first treatment, the bone alignment was addressed first. We closely targeted the unity 1 through osteoarticular adjustments. We've corrected the counter nutation of coccyx into the nutation. Following after was the fascia work at the thoracic, cervical, lumbosacral diaphragms to loosen up and create space for vagus nerve and to improve arterial flow. General and local listen. The straight leg raise test was used to determine the visceral cause in the musculoskeletal complaint of the left hip and left arm. Test was showed positive for the stomach esophagus area. Contribution to the musculoskeletal cause. Then we went for assessing the motility of sphincters. The ileocecal valve, the duodenal jejunal junction, the sphincter body, and the pylorus were rotated counterclockwise except for the cardiac sphincter. The motility treatment was performed with the Chapman points and reassessed. The sphincters were released and started to function normally in a clockwise direction. The home care stretches and dietary suggestions were given before the second treatment. At our second treatment, we started with the fascia, general, and local listen. The visceral manipulation of the organs was done the following way. The affected esophagus is assessed in pair with the stomach. The fascia treatment is done using a seesaw technique and held through release. Reassessment was done for local and general listen. Motility and mobility assessed. Neurovascular technique is next. The therapist was holding the celiac ganglion, followed by T2 to T4 on the right, followed by the vagus nerve. The reflex points were held until ease. Lastly, the Chapman reflex points, aka the intercostal space between the second and third rib near the sternum, bilaterally was stimulated with gentle circular massage techniques. Reassessment showed improvement in motility and mobility. After this, the therapist viscerally manipulated the stomach itself, treating the fascia, neurovascular, Chapman reflex points, as well as motility and mobility, followed by reassessment. The two organs are intimately related, thus we need to target both of them, and we have had them released. The cost-benefit analysis shows that this is a win-win case because the client serves as a great practice patient for the visceral manipulation course. Therefore, the therapist has offered a discount for the treatments. As for the therapist, this benefits him in the sense of gaining unique experience in dealing with the visceral organ manipulation. As for beneficence-maleficence principle, there is no harm predicted in the study. One thing to point is the patient does feel sensitive in the area of the reflex points. Therefore, pressure was adjusted during visceral manipulation. The therapist does acknowledge there are limitations in our study. First and foremost, number of subjects is limited to one, as it was difficult to find anyone recurring patient with GERD condition. Secondly, there are multiple lesions in our patient's health, including the possible mental health issue factor, and could contribute to reprovoke the conditions which we are trying to solve. The short-term goal for our client is to maintain a healthy structural alignment in low back and sacrum area, as well as addressing all other organ lesions that are still present in our client through regular attending of the osteopathic treatments. Also, the therapist recommended proper diet and habits to curb down the aggravating factors for GERD. The long-term goal for the patient is to address overall well-being, addressing his other lesions listed. As mentioned above, the unhealthy lifestyle is the biggest factor in GERD. Therefore, the client is encouraged to see the medical doctor, the nutritionist, and the psychologist to help find coping methods in dealing with other lesions. It is important to underline that osteopathy is playing a culminative role in solving our client's physical lesion through visceral manipulation, as witnessed by the great results achieved in our study. An important point here is that the visceral testing has allowed the therapist to uncover some deeper problems which still need to be addressed over next sessions. The tension and the acid reflux in the stomach and esophagus was completely gone for over a week-long period. Also, the achy, painful tension in the chest has disappeared as well. Conclusion: in this case study, the therapist has gained significant clinical knowledge for assessment, palpation, observation, and treatment skills. We've introduced and tested the visceral and neurovascular techniques as it's best suited for the GERD patients, while staying loyal to the prerequisite osteopathy, osteoarticular, visceral, and fascial remodeling techniques. It was obvious that they all worked out to our best outcome when used together. The lesson is clear regarding the effectiveness of local listen assessment and organ treatment techniques. but also in regards to the resetting of the inner organs from sympathetic to parasympathetic mode and allowing better mobility, motility, and motricity to occur. Therefore, we can conclude that the experience has been gained here is surely valuable, and the therapist is going to use it freely for our future clinical practice when addressing patients with GERD symptoms. Thank you.